don't kill yourself trying to do 10, 11, 12 different things all at once because you think, right, well, if I don't have this, I won't compete and I won't get the number. Because like I said, there are training opportunities all across the country that will be excellent.
Welcome to the Life As podcast, a series of conversations with inspiring people about what life is like in a number of roles you can do before or during cardiology training. I'm your host, Jonathan Bray, and over the next couple of months, we're going to bring you weekly, concise and insightful discussions. On behalf of the British Junior Cardiologists Association Starter, we're really excited to bring you this series. Today, I have the pleasure of being joined by Dr. Holly Morgan, a Wales cardiology registrar, who is currently doing her PhD at St Thomas's in ischemic cardiomyopathy. Thanks very much for your time today, Holly.
No problem, nice to be here.
So Holly, just to kick things off, I wanted to ask a little bit about your reasoning for applying to train in cardiology. At the time, what was going through your mind?
Yeah, so I think I was relatively late compared to some of my colleagues in deciding. I was pretty fixed on doing intensive care when I was sort of F1, F2 level. And then I went out to Australia for F3. I sort of randomly was lucky enough to do a cardiology, what they call reg job out there, but that's just SHO level. And I completely fell in love with it. I just thought, lots of people I was working with, there'd be very chaotic situations and they would bring the calm. Everybody else would be like, oh, thank goodness they're here. I can remember loads of cases, whether it was a STEMI or a tamponade or even something really simple like a fast AF or something. Everybody else seemed to be a little bit flappy and they would just come in and be like, right, this is the plan, this is the treatment. And the combination of being quite cool, but also fixing the patients really rapidly. I found that completely fell in love and came back to the UK, did my CMT with, whatever it's called now, IMT, very much aimed on cardiology and I've never looked back.
Brilliant. Yeah, I think that you made a really important point about trainees at this stage making these important decisions by looking at the people ahead of you and sort of trying to imagine yourself in that role. But of course, from the other side, you can't always get the full picture. What are the worst bits and even the best bits of the job, in your opinion?
Yeah, it's a good question. There are loads of best bits. When you first start doing procedures and you do your first angiogram, let's say with the consultant sort of not even touching the patient, that's really exciting. When you think you've been that person who's come in and been really calm and fixed the patient, all those kind of things, absolutely love that. But it is quite hands-on. It is, in terms of work-life balance. So some of the worst bits maybe are just the fact that you will probably stay late. You will probably be asked to do research projects and audits and prepare for MDTs the following morning and things. It depends on the kind of person you are and also how much you enjoy cardiology because, I love it. So it's not really that much of a chore, but I can see that sometimes, you get carried away perhaps with how much time you spend on the job. That's probably one of the worst aspects, I'd say. And then obviously currently I'm sort of out of program, as it were, doing my PhD. And that's a really funny change because rather than being in the hospital all the time, you're really flexible and you have to be really self-motivated. But again, I think you get a bit addicted to doing. So again, you find it hard to switch off because you haven't got that structure of the shift. Often your work will encroach into your evenings and weekends. So it's different. It's still enjoyable, but it's a bit of a different way of working.
Yeah, absolutely. I mean, there's a big contrast between being a clinical cardiology training and then PhD, I can imagine.
Initially you feel like a fish out of water. When you first start, you feel like completely lost, but then you do find your feet quite quickly.
Yeah. So you touched upon work-life balance. For a lot of people considering the specialty, the ability to be able to combine work with what you already do outside of work is quite important. how would you describe your work-life balance when you were a cardiology registrar?
I think it was still really good. And I think it goes in waves. So I think, if you're perhaps doing an echo exam outside of work as well, there might be a month or two when you think, oh, I have done a bit more work than relaxation or social activities. But then there'll be other times when you'll still go on holiday and do lots of things with your friends in the evenings and weekends. So I definitely think that it's flexible and you don't have to be at one end of the extreme. There's certainly people who have children who have less than full-time work patterns, and they very much manage. So yeah, I think it's easy to get swept away and have a very poor work-life balance, but I equally think that there's definitely ways of making it more healthy and normal.
Yeah, definitely. So give us sort of an example week. What would you be expected to do, and what's the kind of variety you see in your week?
Yeah, so different hospitals sort of structure your registrar sort of rota a bit differently. But from the sort of two that I worked in, you'd generally be doing it sort of at least 2 clinics a week, which is always the worst bit of the week, but it has to be done. And then you get a few days in the lab. So sometimes you might be on a pacemaker block or an angiography block, and often you might be in the lab for sort of up to a day or 2 days a week, which is really great fun. Sometimes you're put in blocks where a whole week is your ward week. So of course you arrive in the morning, do the ward round, CCU and the rest of the patients with a consultant. And then sometimes you might spend your afternoon seeing referrals on other wards from Gen Med, care of the elderly, gastroenterology, etc. So yeah, a bit of a mix of lab time, clinics, ward rounds.
Yeah.
And then, there's usually at least sort of one session a week, or there's supposed to be, that's factored in for a bit more of your admin, because as a more junior doctor, you don't really appreciate how much admin you just create as a registrar. You dictate all these letters in clinic and you request all these random studies, and then suddenly all of the investigations are coming back to you. So yeah, sometimes that takes a bit of time to get used to. I think in my first job, I didn't check it was called a pigeonhole at the time. I didn't check it for a while. And then when I finally did, I was like, oh my gosh, what's all this stuff? But yeah, I guess it's just preparing you for being a consultant, when I'm sure the admin is a whole nother level. So it's very varied.
Yeah. Well, I'm glad to hear that there's additional time to do those things. You're not just expected to do it outside of work.
Depends on the hospital.
Yeah.
And I suppose I haven't really touched on call. So nearly all jobs would have an on-call rota, whether that's a 40% banding, something like that. And the on-call, obviously, most places sort of ST3 and ST4, you're the med reg as opposed to being the cardiology reg. And actually, I sort of dreaded being the med reg, thinking, oh, I just want to do cardiology. I don't want to do all this medicine. But I really grew to love it. And I think as a cardiology reg, you're actually really well equipped to be the med reg. You're one of the calmest people. You're not really scared of the cardiac stuff. So actually you become really competent. It's a bit of a long shift sometimes, but can be quite enjoyable when you're just sorting these patients out and get to the end of your day and you think, oh yeah, smash that.
Yeah. So while we're on the topic of on-calls, and we've talked already about how you described cardiology registrar as coming in and bringing the calm, what would be your most challenging moments that you've come across so far?
Yeah, I suppose it's probably a bit of an overheard, boring answer now, but I really think it was the beginning of the first wave.
Yeah.
So I was working in Newport in South Wales, and we had a lot of cases very quickly. And I know some parts of the country took a bit longer to take off, but I remember we were one of the fastest rising areas at the beginning, and we just weren't prepared. We didn't have those red areas. We didn't really know what we were doing with PPE and stuff. And sadly, patients were just dying sort of, and every single shift you would do, there would be multiple people very hypoxic and things. So obviously we're through that now, luckily. But yeah, I think it was just the sort of being overwhelmed and being in a position of feeling like you weren't being able to help like you wanted to be. But just on more of a cardiology type basis, because obviously the COVID thing should hopefully not happen to us again now. I do remember being called to a cardiac arrest a couple of weeks into my ST3 and they'd figured out it was a tamponade. And just that assumption that, oh, well, you're the cardiology reg, so you can come and fix this straight away. And in your head, you were like, well, I was the SHO 2 weeks ago. And luckily, it all went fine. I should add that it was out of hours. Otherwise, obviously, I would have got somebody else to come and do the drain. But yeah, I think hopefully outside I was displaying calm, but definitely inside I was thinking, oh my gosh, surely somebody else should be doing this.
I mean, that's why they've brought in IMT3 to try and grade that progression from SHO to cardiology. Well,
hopefully that helps a bit, but it is still that first initial thing of doing your first one on your own. But it is also amazing. So yeah.
But I mean, you make it's such an important point that in the beginning of COVID, when you're beginning your registrar training, must have been so difficult. What do you think the things that you've taken away from from COVID and from going through that you think will benefit you in your training going forward?
I think, I don't know if everybody else feels the same, but things just happened so fast, didn't they? You wanted the rota completely rewritten, it happened. Wards needed to be all single bays, it happened. There was loads of changes happening really quickly, and I think because our hospital was relatively small, I felt like I was quite involved in almost a management side of things I'd never really had to deal with before, in a WhatsApp group with sort of really important consultants and things, all discussing how the backup rota would work and all this stuff that I'd never really been involved in before. So I think from a management side of things, I would be better at coping with crises and things. And we might not have another viral related one, but I'm sure there'll be endless bed pressure issues that we need to deal with. So certainly that. And then, just maybe being supportive to all the juniors around us. So we had lots of sort of meetings in the mess where we were trying to say to all the more junior colleagues if they had any questions or if they had anything they wanted to talk about, if they were upset and things. So hopefully more of a supportive role, because obviously as a reg, you're suddenly someone people come to more when you haven't really had that before. So I think that's probably going to help in the future.
Yeah, we've talked a lot about your role as a cardiology trainee, but of course you're doing your PhD at the moment. What value do you think taking that time out in your reg years to do a PhD has on your specialty training?
I think it's a really good decision. Of course, it won't be for everybody, and I'm not sort of saying that if it fills you with dread, you absolutely have to go and do research. But it just equips you. You learn skills you never really knew that you didn't have, if that makes sense. So you learn so much more about how a trial actually gets off the ground and what the flaws might be within that research, because you learn how difficult it is to recruit and how recruitment criteria might get relaxed because of difficulties. And suddenly you realize that all these trials that we base our practice on have lots of flaws. You just get a bit more critical in your thinking about all the things you're reading, and don't just think, right, well, that's the abstract, ticagrelor is better than prasugrel or whatever way around, and then I'm going to carry on. You sort of think, right, well, how did they do this? What were the hiccups and things? And also, clinical training is quite full on. I'm not saying that PhDs are easy by any stretch, but it is a bit more time to be more flexible, to control your own hours a bit more, which is just something you don't get at all when you're F1, F2, any of those years. So it has been quite nice just to say, okay, well, I can have my Thursday morning to do whatever I want, and I can catch up on Sunday if I need to, or just so much more flexibility. And you can get involved in other roles that maybe you just wouldn't have had time to do if you were full-time clinical. So from a life perspective, but also just from building skills that will be vital later on. I think if you're thinking about it, I definitely recommend going for it.
Yeah, absolutely. I've talked to some people before who have said that, taking that time out during reg years to do a PhD is also fits very well with like having a family, because, when you have children, that flexibility really helps.
Yeah.
Yeah.
Although I do have a colleague who has multiple children, and he's also finding it quite difficult to do both, to meet all the deadlines and things. But it's individual, isn't it? I think you obviously can take mat leave and things as per usual in the middle of PhDs or paternity leave if you need to. It's just a change of pace, and I think that's really nice.
Yeah,
it's nice for us to get out of that clinical sort of endless treadmill sometimes.
Yeah. So you were working in Wales, doing a lot of your clinical stuff, and you've also, and now you're spending time in London. Do you think there's any merit to like where you do your training, and do you think that like what would lead you to choose where to train?
Yeah, I think that's a really good question, and something that I thought about a lot, because I'm where to apply for my reg training. I'm obviously a massive fan of Wales, so I'm going to be a bit biased. But I think you don't have to go to London to be a good registrar. You'll probably be a good registrar if you're hardworking and enthusiastic wherever you go. So wherever you want to live, go for that place. Don't think, oh well, will the training be as good, etc. There are going to be problems with training, probably different problems in all different places. So in Wales, perhaps the technology and the research isn't quite as cutting edge as it would be in St Thomas's, say. But then I probably got slightly more hands-on in my SC3 and SC4 year, because there was less people, there was less competition. There's a lot of pathology around. I was working in really busy DGHs.
Yeah.
So there's definitely pros and cons. But obviously, with competition to get into certain places, I think it makes it feel like, oh, well, if that's the most competitive place, that must be the best. But actually, I don't think that that's the case. And you can do what I've done. So you can go and train somewhere else. And then if you want to move to get experience, you can go and do your research, or there's lots of other opportunities out of program. You can go and do that in, whether it's London, Manchester, Liverpool, if you feel that you want that kind of big centre experience. So there's definitely possibilities to sort of mix and match things.
Do you think that, because obviously you've done it that way around, do you think there's any benefits to doing your training where you might want to do your PhD?
Certainly, I'm trying to think, probably most of my group, bar maybe two of us, are London trainees. So I suppose you might bump into people who could be supervisors more readily. That being said, if you're in a different deanery and you're really keen on doing research, you can easily meet these people as well. You can go along to conferences, start conversations. So it probably does help, but training somewhere else certainly does not stop you from going off and moving. And I know lots of people who have moved, obviously from my Wales cohort, there's 3 of us in London, 1 in Leicester, 1 went off to America. So we're certainly not all stuck there thinking, oh, if only we'd gone and trained somewhere else, we'd have more opportunities. So yeah, I think it doesn't stop you. I think just train where you want to live, because you'll do well regardless.
Yeah, that's good advice. So to finish off, what would be your number one bit of advice for someone who wants to do cardiology?
I think I spent a lot of time in my SHO years worrying about my CV and worrying, did I have enough publications? Did I have enough projects? Was I going to get my number, etc.? And I genuinely think in my interview, it just boiled down to being enthusiastic and having shown some interest in specialty over a few years. So I think my bit of advice would be, I'm not saying don't get involved in projects, obviously, get involved, but don't kill yourself trying to do 10, 11, 12 different things all at once, because you think, right, well, if I don't have this, I won't compete and I won't get the number. Because like I said, there are training opportunities all across the country that will be excellent. So yeah, I think that's probably my main bit of advice. It is hard to get into, but it's probably not as hard as you're making it feel in your head. And you do need to still have a good work-life balance in the years leading up to cardiology. So just be enthusiastic. If you want to get involved in things, I'm sure you can approach the registrars and consultants and things that you work with, and they'll be very happy to have someone involved, but you don't need to do everything. You'll make it regardless.
Yeah, that's good advice. Thanks a lot, Holly, and thanks for your time. It's been great.
That's okay, no problem. If anyone's got any questions or they want more advice, I'm very happy to be contacted.